Diabetes is a serious disease. However, it's so treatable.
Diabetes is not something that limits your life. It just makes you aware of what you're supposed to be doing for yourself all along.
You've got to look at the disease, diabetes, as a lifestyle.
It just becomes a part of your life. You don't think twice about it. You just do it.
It's something that you can do as long as you put your mind to it.
And I just know that I have to work at every day, trying to check my diet and see how I'm eating and make sure that I get exercise.
It really comes down to not getting discouraged and making persistent and positive changes that they could live with.
Being diagnosed with a condition that can affect every aspect of your life, from the physical to the emotional, is extremely challenging.
Like any young individual, I think you set it to the side and you don't think about it. You hope that it's going to go away on its own.
I had yo-yoed with my weight back over the years, and I've done everything that somebody had told me to do about diets, about watching your carbs and everything, but nobody really had the answer, and the answer is to motivate you as an individual to take control of your life.
Don't be in denial. Don't lie to yourself.
You just have to come to grips with it, because you have to take the meds, you have to monitor your blood sugars, you have to eat the right foods, you have to do the exercise. So that's how you take control.
It's never too late to take control of your diabetes and have a good quality of life. Yes, you may have to take medications, you may have to go to the doctor more, but it's very important that we overcome ignorance, fear, guilt with education, motivation, and self-advocacy.
I would just beg everybody to come to Taking Control of Your Diabetes conference. Just come and learn and educate yourself on what you can do just one time, and it'll change your life.
I was hooked after the first one.
I say if you want to find out the real facts, come to TCOYD. Come to their conference, come to their workshops, get with them online, because you'll get the facts before they come out publicly noted.
It's almost like coming and getting a drink out of a fire hose. There's so much information.
I think it's even hard for doctors to stay on top of everything, so it feels empowering to be able to come here and get all that information.
People are energetic, they're excited, they're excited to learn. It's not boring, dry information. It's presented in a way that's very colorful, happy, and in a way that people understand.
A todos los hispanos les digo que es importante que si hay diabetes en la familia, que se ayuden y que vengan y escuchen los doctores para que aprendan más, para que se puedan cuidar bien.
Now that I'm done having kids, that is what kept me so motivated and on it and super diligent with the diabetes. So I do have to say I'm struggling a little bit now with, now what,
It's not that I don't know what you're supposed to do. You get to the place like, I'm busy today. I don't want to take my blood sugar 4 times today. I don't want to exercise today.
When you come to a conference like this and you see people from all walks of life with diabetes and how they are managing their diabetes and living, normal lives, to me, it's just a wonderful thing.
I think that's a really important piece of the whole diabetes puzzle, is having that community of people to support you who get it in a way that even your closest loved ones can't.
I've had a lot of positive feedback. I've had a lot of conversations with people that gave me hope.
It's just keeping yourself on track to do the things that you need to do to keep healthy.
I sometimes pretend I'm a superhero with all my gadgets. I call myself Gadget Girl. It's like my ulterior, whatever.
This is our disease. The doctors don't have it, we have it. And if you're going to empower yourself, you've got to take control and question when a doctor tells you something.
I've become very well educated in the medical field. And now I can go into my doctor, and my family doctor says, you know what questions to ask me, you know what to do now. And I said, it's all because of taking control of your diabetes has taught me what I need to ask.
It's your life, and you need to push. And don't let them say, no, you can't do this, you can't do that. Push it.
Does it really matter?
What cuss words she could use other than non-compliance?
The caregivers of this country have a lot of work to do. They don't have much time to do it. They have very little time to keep up with the latest advancements. And my advice to them is to try to stay educated on the latest advances of diabetes and avoid what we call is clinical inertia, taking too long to make changes in the patient's regimen when the glucose control is not there. So it's basically being persistent, using the medications that work, and individualized therapy, but making those changes in a much more rapid sequence, not letting your patients go sweet for years on end.
What about you who are healthcare professionals? What have you run into working with a person with diabetes that really was wonderful?
People do well when they have a good relationship with their healthcare provider. So one of the things that I pride myself is doing that.
Something like this empowers the person to take control.
The information that is presented is tangible, it's practical, and it's doable.
It makes you know that you can change your life.
And you may discover you'll know as much, if not more, than the doctors that are treating you now. And I tell you, it's nice to have that power.
Drove a long way to get down here. It was worth it.
Every session was fantastic.
Very informative.
Learned a lot. I learned that my pump's not doing for me what it should be, so I'm going to be making some changes and getting some more information.
It gives you empowerment to go back with your physician and not give up so easily.
Since I love life, want to live, got a lot more places I want to travel and see. The only way you're going to do that is to do the right thing.
I think there's something empowering about knowing so much about my body, and I don't know that I would have run a marathon or raised my family as healthy as I probably am had I not been diagnosed.
I have type 1 diabetes, and it's given me a mission. It has. Look at me. You know, I'm 62. I love life, and I'm not going to let my diabetes get in the way of anything.
You can live and be happy with this disease.